Hi, I'm Drew Rambler. I'm an infectious disease doctor, and I'm trying to give an update on the coronavirus. It is Saturday, March 14th, so keep that in mind as far as the data that I'm trying to present, interpret, or give an opinion on. I would direct you to reputable sources for information to verify or get more information about what you've been hearing. These would include the National Institute of Health with Tony Fauci, the World Health Organization, the CDC. Johns Hopkins has a coronavirus tracker with pretty real-time updates for states and countries that you can click on to see what the impact is in that area. And then I would really direct you to your local state Department of Health because they've been doing a great job of providing information as far as up-to-date case counts and such. So what is coronavirus? Coronavirus is a pretty well-known virus that causes the common cold. But like most viruses, there's a continuum. You can have mild, this sucks for a couple days, to I'm really sick in a hospital on a ventilator trying to die, or dead. We're still trying to figure out what this one's doing, but we do call it a novel coronavirus for a couple of reasons. Number one, it looks like it's genetically related to a bat coronavirus, which if you look at the family tree of coronaviruses, it's not that close to the coronaviruses that infect humans. So therefore, we haven't seen stuff like this yet. That's also probably why we consider about 100% of the population around the world susceptible to this virus. Now, yes, it is true that 80+% of people have mild to minimal disease and will recover just fine. But there's a lot of people in the world. And this one is preferentially hitting a certain group harder than others. People with chronic medical conditions that are immunocompromised or that have heart disease, lung disease, including COPD and emphysema, maybe asthma, and especially, or not especially, but big time, including people who have diabetes. That's a big population is what I'm trying to say. It also seems to be that the severity and or death risk starts going like this. Let's start over here. Young, adult, 50-year-olds. So it looks like the curve starts to really go up at about 50, where people are more at risk for severe disease. And by meaning severe disease, including death. So we have 100% of the population. It potentially is killing people with certain risk factors. What else is going on with this coronavirus? Well, it's considered a pandemic for why? It has been unable to be contained, and it is spreading through multiple countries, and it very quickly went into community spread. It just wasn't all travel related. So now we're getting community spread person to person. So let's talk about spread. Spread from a coronavirus is probably like all the other coronaviruses. It's spread by droplet respirations, or droplet spittle, or droplet sneeze, or droplet cough. It's not just floating through the air. It's actually going out on little bits of spit or snot or whatever, and then sort of floating down to whatever surface it can land on. So we think that, with looking at a sneeze of a human, it's about a 10-mile-per-hour blast of air, and you get a decent radius, or a decent zone of about 6 feet. Okay? So we need to keep that in mind when we're thinking about how to control this. Spread is also inanimate objects. We know from previous coronavirus infections, and I'm going to bring up SARS and MERS, SARS out of the Guangdong province of China, MERS out of the Middle East, were both novel coronaviruses. In fact, this one, the COVID-19, coronavirus 19, is considered SARS-2. By the way, it stands for Severe Acute Respiratory Syndrome. So we know from that we were finding viable virus on porous glass surfaces like 96 hours after contamination. Some plastics a couple days. So it can live outside of a body on inanimate objects for a little time. We don't know all the details, but let's just consider it does. Okay? Secondarily, person-to-person spread. Well, obviously, someone coughs straight in your face. That's a no-brainer. But usually you contaminate your finger pads, and your finger pads instinctively are all over your face all day, every day. It's a habit. It's a way we perceive things. We are naturally hand-to-face creatures. So we need to have great environmental hygiene and great finger and hand hygiene. Hence the wash your hands. I'll again direct you, Johns Hopkins. You can search Johns Hopkins hand washing video. There's a 1.5-minute video. It's pretty intense as far as it looks more like a surgical scrub video, but it also goes over some things. Excuse me. Got mine, I guess. It goes over things about handles and how to deal with that without contaminating yourself right after you wash your hands. Natural disinfectants do work. Soaps, laundry detergents, things like that. So, keeping clean, a little bit more obsessive right now. Social distancing yourself. So is the paranoia legit? Well, maybe. I can't say it's not. And I think it's unfair for someone to say this is just a common cold, and roll their eyes, or this is the Armageddon killer and roll their eyes. I think that's being naive. I think that's because of a little bit of lack of information. And I'm not saying it's their fault, but it's not quite the right way to look at this in my estimation, in my opinion. So, why do we care? Why go through all of this if the majority, I already said 80+% of people are going to have mild to no disease? Why shut down the schools? Why shut down the sporting events? Why cancel trips? Well, containment is about the only way you can control pandemics. What's short of a miracle cure or a vaccine, which we don't have right now. So in that respect, the best we have is social distancing, and canceling all these things is sort of forcing social distancing on you, and good hand hygiene, which most of us don't have. Let me give you an example. I'm not in the high-risk group right now, but I go out, I contract the disease, I come in contact with someone who's positive for COVID-19. What's going to happen to me? Here's what's going to happen. On average, 5 to 6 days, I'm going to be incubating that virus inside of me, which means replicating it to levels. The immune system is ramping up at that time. What's going to happen is I'm about 5 to 6 days of not having any symptoms, and that's when symptoms start. The problem is about a day or two before my symptoms start, I am shedding the virus by breathing, by talking, by contaminating these to contaminate other stuff. I'm shedding it so that other people could get it. So there's a bunch of people who are perfectly fine, and in 2 days they're sick, but they've already spread the virus. Okay? I don't want the school kid or myself or my colleague bringing it back to my home, my community, wherever. I'm a physician, having people who are susceptible with comorbid conditions coming to me, where I could inadvertently infect them because I'm in that what we call window phase where I'm infectious but I don't have any symptoms. We need to have some social responsibility here. And we need to be careful of those who have diabetes, heart disease, and lung disease, who are immunocompromised, who are older, that they need to be protected by the community. It's called herd immunity, but this would be herd responsibility, I guess. Interestingly, of all the risk factors, unlike influenza, pregnant women don't seem to react any worse to coronavirus than if they were not pregnant. In influenza land, you get pregnant, you're going to get potentially influenza a lot worse. This one doesn't seem to do that, which is good. So, in a sense, pregnant women are not at an increased risk, which is a good thing. At least for right now. Let's see what the data shows, but right now that's what the trend looks like. And it looks like healthy people under the age of 18 are doing pretty stinking well. Now, they may be carriers and vermin, but they look like they're not going to be affected as bad as the other people. So, what does this mean for you if you do get an illness that is consistent with coronavirus? If it's a cold or a bronchitis and you say, this sucks, this is my early spring cold, stay at home. Isolate yourself at home so you don't contaminate other people at home using the hygiene habits that we've talked about. Don't go to the doctor office just for that, just to get checked. Okay? If you are sick enough that you have an underlying condition that worries you for severity, lung disease, you're on oxygen to begin with, and then you get this, not a good thing. Immunocompromised, you're on some kind of immune modulator for your arthritis or your Crohn's, or you're on chemo. It's worth a phone call at least to triage to see if you need to come in. But if you can stay at home, stay at home. If you need to come in and you're having symptoms, if you can find yourself a mask, wear it to the office, to the urgent care, to the ER, or a lot of the healthcare professionals who will be dealing with this do have masks around. And why? Because that protects the droplets from getting out and contaminating things. It stays right in the mask, okay? The mask does not help you if you are not infected. It doesn't stop you from getting the infection, so don't utilize the mask. We don't have enough in this country for everybody to do that. We're running out for the people who need it in healthcare. So I would say if you don't have the infection or think that you're coming down with the infection, don't go out and hoard masks. Okay? So we need to be careful of the burden that this causes on healthcare. So we can do our part by doing those simple things. Social distancing, proper hand hygiene, and not burdening the healthcare system unless you need it. I'm not saying stick it out. If you're sick enough, go. But if this is just your run-of-the-mill cold, stay at home. Updates potentially will be coming as more information comes.